note that this topic was developed by Angela and I when we were on the ISUOG outreach team in Rwanda. Unfortunately, that program was cut short due to COVID, but hopefully we'll be able to return and finish the program at some point. And like Angela mentioned, I think this is a very under-recognized topic, and worldwide, it appears that how people maintain and clean their probes and disinfect them is not adequate to prevent infection. So I'm sure that all of you have seen probes and cables that look like this. You see this cable that somebody has ran over repeatedly and not given the love that an ultrasound and cable deserve. And this probe with caked on gel that looks like it's been dried and used repeatedly between different patients. This one even has some dried blood on it. I hope after this session, you'll avoid these practices and clean and disinfect your probes. So for background, and why this topic is important is that ultrasound transducers, both external and endocavitary or transvaginal, can carry pathogens and present contact between patients and spread infections. External transducers, these are ones that contact skin, and these can be things like staph and strep or common skin pathogens. This would be like a stethoscope that you move between your patients. You should clean that as well. Endocavitary transducers or transvaginal transducers, these have more serious risks, and it's been noted that these can carry pathogens despite the use of covers, including HPV. It's been found that the medical grade transducer covers don't adequately protect against HPV, and neither do standard condoms. So it's been found that non-lubricated, non-medicated dry condoms are the most effective at preventing HPV transmission to your probe. So because of this, cleaning and disinfection is necessary for infection control. Here's a couple of definitions. So cleaning means removing the visible soil, either manually or mechanically. This is just using soap and water on your probe to get rid of what's visible. This is probably the most important and key step for cleaning and maintaining your probe and equipment. Next is disinfection. This implies eliminating most pathogenic organisms. This is what's necessary between patients and can be divided into mid, low, and high levels of disinfection. These are terms based on regulations from the US FDA and may not be exactly applicable to your setting, but high-level disinfection is recommended for transvaginal ultrasound. Sterilization, this is elimination of all forms of microbiological life. This would be putting your surgical instrument through the autoclave and making them sterilized. This is not necessary for most forms of ultrasound. So Angela has a question for you to think about.
I think the question is, what do you do in your facility to keep your probes clean, Ben, and especially between patients?
We'll let you think about that. You can put your answers in the chat and we may discuss them at the end of the session.
I guess a secondary question would be, do you do anything at the end of the day to clean your machine, and is there a difference between what you do between patients and then at the end of the day?
Very good thought. And this is the ultrasound unit that I worked on from 2018 to 2020 in Lesotho. This is Dr. Malope, who currently runs the unit and provides ultrasound services to the northern region of Lesotho currently. This is a region of the world where most women delivered without an ultrasound until the last few years. So we are developing the service relatively rapidly in this country. So on to our topic. We're going to go over the best practices for ultrasound infection control. Transabdominal or external transducers like you use for the standard second and third trimester obstetric scan. This needs routine cleaning. and low-level disinfection between patients. A transvaginal or endocavitary probe, this needs high-level disinfection prior to use on another patient. Again, the key risk to avoid would be transmission of human papillomavirus, HPV. So what can you use for high-level disinfection and what you eliminate with it? So, low-level disinfection, I apologize. Low-level disinfection destroys most bacteria and some viruses, including COVID-19, but notably not HPV, and some fungi, but won't eliminate TB or spores. This can be done simply with alcohols, household bleach, or other common cleaning solutions with a relatively brief exposure time. So these would be like the wipes or methylated spirits that you use on your machines between patients on your abdominal probes. In terms of high-level disinfection, this gets a little more complicated because this destroys and removes nearly all microorganisms except bacterial spores. There are a number of different products and systems and ways to do this. Some of the common ways and common chemicals are used, I have listed out here, but basically this is divided into 3 different ways of disinfection. One involves a high-level disinfection chemical with a soak and a soak time, and then allowing the probe to dry and then reusing it. The second is an automated system that uses chemicals or UV light. I believe Angela uses one of these in her unit. And in some areas of the world, there's high-level disinfectant grade wipes, such as chlorine dioxine. These are widely used in the UK and Europe, are not approved in the US. I would note that some of these high-level disinfection chemicals have been studied and found to not necessarily be effective at eliminating HPV, so I crossed those 2 out. One of those is notably Sidex, which is very commonly used for this practice. So this is a table from the maternal fetal medicine guidelines on probe maintenance, noting the chemicals that are and are not effective against eliminating HPV from transvaginal probes. So I know this setting is geared towards clinicians working in a low resource setting, and I myself worked in Lesotho for a couple of years, and I'm well aware that you may be resource constrained or not have the chemicals available listed. And so I'd like to propose a possible alternative, but the main message is that when you use an ultrasound, you should always clean it, disinfect it with what's locally available, let it dry, and then reuse it. A possible alternative that I would propose would be first mechanically clean the gel off, clean the transducer with soap and water, wipe the transducer with what you have locally available, which could include methylated spirits or alcohol, or chlorine, which is standard bleach, rinse the probe, tap it to dry. And this method has been studied and suggested as effective for high-level disinfection, but not validated, such as those other chemicals. It is noted that alcohol and bleach can reduce probe life, and alcohol has limited efficacy against HPV. So this may not be the best method, but you should use what you can. Angela has another question for us.
Yeah, so at the beginning of COVID, we really had a lot of problems in our unit because number one, we weren't sure what was available and active against COVID because none of these products had been tested. And so the question was, how did your unit adapt to COVID? And are there any suggestions for managing patients who for sure have COVID or some other infection that can be transmitted?
Great, so some thoughts about COVID. In a pandemic situation like this, you might think about using a dedicated machine specifically for COVID patients. if you have the resources to dedicate a machine to this. Consider or recommend a low-level disinfection between all patients, and make sure that you do top to bottom disinfection of the entire equipment, not just the probe and the cables, but everything in the equipment that may have been touched to avoid potential spread to the next patient. And consider transducer covers and barriers. I believe Angela used a large plastic bag that covered the entire unit during the COVID pandemic. So some thoughts of non-probe related maintenance and non-probe related things to keep safe with the machine. As you know, there's sterile and non-sterile gel. When you use non-sterile gel, I'd recommend using multi-dose containers. However, if you can, discard the multi-use containers when empty, don't refill them. Seal the container when it's not in use, and don't directly contact the container between the tip and the person or instruments. And when you use sterile gel, it's preferred to use single-use package that you discard after that patient. And this is recommended for all exams on non-intact skin or surgical sites. You might consider these for endocavitary exams as well. If you have gel warmers, use dry heat warmers only, and disinfect the warmers regularly. Don't forget about your accessory equipment. And in terms of the rest of the machine, don't forget that this is a complex unit with probes, cables, connections, computers, consoles. These all need regular cleaning and disinfection. So we'd recommend developing and following an institutional infection control guidelines on the machine, and do this based on the frequency and use and handling of the exposure of the equipment. Like Angela was saying, think about what you do between patients, but also at the end of the day, weekly or monthly, depending on how often the machine is used and what you need to do to maintain it. And obviously avoid running over the cables. This can damage the fiber optics. Here's another question to think about.
Yeah, so do you have, in your unit, do you actually have a standard operating procedure in place to keep your machine and probes clean and in good condition during the day, and then also at the end of the day?
So we would recommend that you do develop a standard operating procedure and create this for the safe use of your ultrasound probe, and include how you clean it and how you disinfect it. This will vary depending on your setting, but basically the materials required will be your disinfectant, a soak tub if you're using a chemical soak, a logbook to keep track of it, somebody who monitors this logbook, and a timer for if you're using the soak time method. Here's an example of a typical probe reprocessing system using a simple soak method. So first thing that you'd want to do is remove your gel, pre-clean your probe with soap and water. Next, soak the probe in your soak solution. This one gives the example of hydrogen peroxide. Give it the appropriate time and temperature. Replace the solution and keep a log of when it needs to be replaced. Then rinse the probe, let it dry completely, and store the probe.
So Ben, do the handles need to be cleaned as well when you're using these processing systems? And how about the cables?
That is a very good question. So yes, the handles and the cables do need to be cleaned, but they can undergo a low-level disinfectant. So the part that actually goes in the body needs a high-level disinfectant, but anything else that you just touch with intact skin can be cleaned with a low-level disinfectant, just a standard disinfectant wipe. So to finish up, here is an example of a standard operating procedure from the American Institute of Ultrasound and Medicine. And I'll just take us through an example of if we were to do a standard 20-week ultrasound. So this would be an exam using a transabdominal probe on intact skin. And so we would be using an external transducer on clean intact skin. We would not need a cover. We would use non-sterile gel, and then we would do our procedure. Once we're done with the procedure, to reprocess the probe and get it ready for the next patient, all you would need to do is remove the gel, use a low-level disinfectant, rinse it off if you need to, and store the transducer and move on to the next patient. So it looks like we have a couple extra minutes. We will take your comments now. Thank you.
Yeah, there are a couple of, I think this session is going to generate a lot of questions here. Relating to your current comments, someone is asking, is it okay to clean the probe with povidone iodine? Does it damage the probe? And then someone else is asking, how safe are the disinfectant and water on the probes?
So this depends on what disinfectant you are using. It is known that some disinfectants can damage the mechanical components of the probe. The ones that do notably damage probes that are used commonly worldwide would be methylated spirits or alcohol-based disinfectants. These can reduce the lifespan of your cables. Water and soap is definitely safe on ultrasound probes. As far as povidone or tincture of iodine, that one I am not sure about because that's not necessarily used as a high-level disinfectant, but is used as a sterilizer. So I assume that it would work, but I'm not sure if it damages the probe.
I've actually never seen it in any of these, in any of the papers or FDA guidance for something that is used for either low or high level disinfecting of probes. You know, I think the one question is about bleach. How about bleach on probes? Because I think there's issues with the plastics as well from the probes. You know, because some of these products can damage the probes, the plastic on the probes as well.
Yeah, that's exactly right. Bleach is a commonly used household chemical, and when you see it for medical applications, it comes in various dilutions. What you buy as a household bleach may not be the same concentration as what you get for a medical disinfectant. And like Angela said, bleach is known to damage the components of an ultrasound probe, especially the plastics and any metals that may be there. So this may limit the lifespan of your probe if you use it, but it, depending on the concentration used, can be a high-level disinfectant or low-level disinfectant and can be effective.
I think for low-level disinfecting with lower concentrations, people often use it on probes and cables. But for high-level disinfecting, you need 1 to 500 parts per million, which actually will damage the probe. So that's not really a great solution for high-level disinfecting. What do you actually do between patients, Ben, with your ultrasound systems?
So where I work now, we use a soak-based system for our transvaginal probe. And I believe we're using hydrogen peroxide as our chemical. And we're reprocessing the probe between every transvaginal exam. Mm-hmm. For a transabdominal scan, it's being cleaned and wiped down with a standard medical wipe.
Right. So there was a comment from the audience that said that between patients, they clean their probes with tissues. They wipe the gel with a dry paper or a towel, and then Kleenex wipes before the next patient. What do you think about that as a way of cleaning the probes between patients?
So that is probably useful for a low-level disinfectant. So I would suspect that would be just fine for your transabdominal probe, as long as you're effectively removing the gel, cleaning everything off, and cleaning between patients. This method probably is not effective at eliminating HPV, and probably is not totally safe for using the transvaginal probe.
Yeah, I'm a little
question that I see.
Yeah, I'm a little concerned about that because I didn't see any chemical that's involved in that procedure. That's just cleaning the gel off, but it's not even using soap or water, and it's not using a Clorox wipe or a disinfecting wipe either. So I think, you know, sometimes you can transmit skin flora from one person to the next too.
Okay, I say I misunderstood, and I thought these Kleenex wipes may have been embedded with something, but you're probably correct that they are just dry Kleenex, dry paper, and that definitely you may be spreading infections around with that.
Yeah, there's another audience question here. What specific swabs are available for cleaning? Can methylated spirits be used?
So methylated spirits, that's actually what I used when I was in Lesotho, because that was our only locally available product. But I would note that this is not the best system or product for cleaning and disinfecting probes, because methylated spirit has not been proven effective at eliminating HPV, and spirited alcohols can be very damaging to the plastic components of your probe. Mm-hmm. So this may be the only thing that's locally available, but this is not the ideal solution. Some specific swabs that are available in the UK, the brand name is Tristel, I believe, and this is chlorine dioxide. And this is a rapid use, high-level disinfectant. There may be others out there depending on where you are and based on your local guidelines.
Yeah, I think the most important thing about this is that you really do need to clean your probes between your abdominal probes between patients with some sort of wipe after you get rid of the gel. And you also should consider cleaning the keyboard and the cables of the probes and the bed or the cot that the patient stays on between patients for best practices. And then at the end of the day, the gel bottle and the gel container and the transducer rests should also be cleaned as well. And you should I tried definitely not to put a gel, a transducer with gel on it into the transducer holder, because that just makes it later on, and to clean that out because it can get dried and nasty. And for the transvaginal stuff, a non-lubricated, non-medicated condom over the vaginal probe, with the vaginal probe being treated with a high-level disinfectant and the handles and the cords wiped with a low-level disinfectant, seems to be the best practices worldwide. But I think, in general, the guideline is that you need to execute guidelines given the extent of your resources that are local. And so, this may involve working with some infection control people in your environment, exploring some of these chemicals that are available. It's pretty complicated, actually. And, and one of the problems I think is that, there's a lot of things that are available for disinfecting and they're all given by their chemical names, and you don't necessarily know the product names, so it doesn't make it easy to figure out what's available. There's another question here from about hexadine 5% for disinfection of the probe.
Yeah, so chlorhexidine is one of the US FDA approved high-level disinfectant. It comes in wipe and liquid formats. So wipes are not approved for high-level disinfection, but the liquid is. So that's a good question. I see another question. Does recurrent to probes, crystals to fluids such as water and disinfectant solutions have any adverse effects long-term? And yes, it can, depending on the solution that you're using. So water is definitely safe for ultrasound probes, as is just standard soap. And disinfectants that have chemical properties that don't damage probes are safe for ultrasound probes. But some disinfectants can damage the plastic casings and other parts of the equipment and limit the lifespan of the probe. And you might think that, but unfortunately, it's been shown that both the medical grade probe covers and standard condoms have been shown to transmit HPV to the probe itself. And so the condom itself is not adequate just to prevent the spread of this.
Mm-hmm. Yeah, I think the WHO actually has acceptable quality limits for condoms and surgical gloves and regular gloves. And actually the best of the products, and also for commercially available probe covers, the best of the products is actually a condom, because the AQL is only 0.25%. That means that that's the percentage of the products that are free from holes. Whereas surgical gloves have a 1.5% AQL and regular gloves a 2.5% AQL. And then the commercially available probe covers can vary between 0 and 5% depending upon the brand. And so, so the question is, you know, you want to use your highest available, the type of cover that has the best performance for this. And so number one would be condoms with a known AQL, and then second would be surgical gloves and regular gloves. Regular gloves not quite as effective as surgical gloves. Now, you know, each of these products is expensive or has some cost to it, so you'll have to figure out in your settings what is best. But I think if you know what the relative problems are with the, you know, with the different products, that's actually a good thing. So it can help your choice of products.
Definitely, and this also brings up that no product is perfect, and all of us live in a setting that's not ideal, so we adapt to what we can. Which brings up the next audience comment that cleaning between patients is difficult due to high patient turnover. And I understand that many of us work in very high volume places where there's a long queue of patients waiting for their scan. But I hope we will take a moment to clean and disinfect and limit the next patient before we move on to the next patient.
So are there any additional questions that we have here? I mean, I think we've got great questions coming in from the audience. So some of the, I think in one of your slides, Ben, you mentioned automated systems. You know, I think the automated systems are great, but they're extremely expensive. And that limits their availability in low resource settings. So I think that the soaking solutions or the high level spray solutions are probably the best of the options, you know, in those particular settings. Yes, I think we probably have talked about this topic enough. I think we've given you some food for thought. You know, as Ben and I were thinking about this session, we thought that there was probably an opportunity for an ISUOG guideline that could be written on this particular topic. And I think, because I think it is an important topic, and I think that the options in low and middle resource countries are different, clearly different than in other countries. I think it's clear that we should execute some kind of guidelines, have standard operating procedure, but we should think about these issues so that we can take the best care of our patients possible. I think we should end now. Leona, I'm going to turn this over to Leona. Thank you very much, Leona, for and also to Kipros for inviting us to share this information. And thank you very much for putting together a fabulous program for the last 2 days.
Thank you, Angela, and thank you, Ben. Actually, I was very impressed with the session. It was very interactive and lots of questions from the audience, as I can see. It just demonstrates how diverse our practice is in terms of taking care of our machines and equipment. So I'm grateful for your insight. Now we are in the closing session, and I wonder whether Kipros would like to say anything.
Well, thank
whether
you
you
very much
enjoyed today.
Thank you very much to everybody for coordinating this meeting. It was a great success. Many thousands of people from many different countries. And the only thing I can promise is that we must continue to have this type of meetings, really. It is important to reach out not only to the so-called developing countries, but to all countries. Every now and then, I think ISUOG, being a charity organization like the Philanthropy Foundation, we should have free of charge courses for everybody. And I look forward to the next one, hopefully in a few months.
Thank you. And for me, it's been a very it's a very informative day, and I really do hope the audience has enjoyed the day as much as I have. And today we've gone for a slightly more interactive approach. I do hope you also appreciate that. And I was checking the numbers. I've been told we have 6,000 registrations across 100 countries or regions. So it's a great success, as we have learned throughout the day. And I want to thank all the speakers and chairs and all the staff at ISUOG for making this course possible. And I think the Ultrasound Essentials course truly represents our charitable mission at ISUOG, and making education free and widely available is the heart of what we do at ISUOG. I think hopefully we'll be making the recordings on demand to all our registration or to all our registrants and faculty members over the next three months, and do watch the space once the recordings are available for your viewing in your own time. And as obviously Kipros has alluded to, that he wishes to continue with this collaboration, which is absolutely fantastic news for us. So indeed, to our next meeting. And I look forward to seeing some of you in Seoul for World Congress in October. Seoul is in my part of the world, so I really do hope that it will be a great success. On this, I would like to thank everyone who is present here, and I wish you a very good evening wherever you are on Saturday. Thank you.